The future of medical training may be in the hands of robots. Gomard Scientific has created HAL, a realistic child robot for medical training that can cry, bleed, and react like a real child patient. We have HAL here on the set today, and joining me right now is Gomard Scientific Corporate Planning Vice President James Arquetto and Dr. Mikhail Varshavsky, also known as Dr. Mike. Great to see everybody. Thank you so much for joining us. James, let me start with you. Tell us about HAL and what was the inspiration for creating HAL.
HAL is really designed, Maria, for training physicians, nurses, first responders. What we want is physicians and healthcare practitioners to really be prepared for those critical situations with patients before they ever get there. So this is a chance for them to really learn on a clinically accurate patient.
So how does HAL do that?
HAL does that with a combination of electronics, software, and hydraulics inside. So you can see his eyes are moving now. He has facial expressions. And the reason for that is physicians get a lot of information from that. And 5-year-olds don't always talk and don't always provide that information verbally. So we had to do it in a way with servo motors and electronics and software.
Dr. Mike, you're a practicing doctor. We're seeing the video of HAL getting blood taken from him.
Yeah, I mean, when I was training, we didn't have simulations this real. We had a basic dummy that didn't move, and you'd be doing chest compressions. At best, you hear a click to know that you were doing chest compressions in the right way. Here, it sounds like you have the entire picture. You have the emotional feedback. You have visual feedback. You can do procedures on him. And I know you mentioned earlier in one of the segments that you don't want him to look too realistic because you were worried about being traumatic to medical students. What was traumatic to me as a medical student was going into my first surgery rotation and not knowing what to do because I didn't have experience on such a high-level simulator. So having this experience, knowing how to do the procedures, being able to look at a child and seeing it react back and forth with me, that's priceless.
How will he react, though? I mean, James, walk us through some of the medical scenarios that HAL can actually replicate.
Let's say that a child goes into respiratory distress, asthmatic on a playing field, for example, playing soccer, has an asthmatic attack, goes into respiratory distress. HAL will respond appropriately to that. He can actually be intubated to help him breathe. If he goes into cardiac arrest, he can be defibrillated with real energy. So as Dr. Mike was describing, those real clinical experiences can take place right here on HAL. And you'll notice I'm controlling him from a tablet here. He's not plugged in. He's completely untethered, Maria, because accidents take place wherever, not always in a hospital.
So this would be helpful to you?
This would be helpful to everybody because we're talking about nurses, we're talking about first responders, we're talking about training physicians. And in reality, you never know what to expect in the situation. So the more simulations you can be put in as a trainee, the better you're going to react when the time comes to make a decision. Because it's really traumatic. In the scene of an injury, in the scene of someone having an asthma attack, your mind starts racing. And if you don't have experience with a simulated patient before that, it makes it really hard to make the right decision.
What's the downside risk here, James? I mean, I understand the benefits of having HAL, as you very well articulated it, but is there a downside here? I mean, robots are getting better and better and better.
Yeah. Remember, his objective is training. He's an educational aid to facilitate folks like Dr. Mike in their training experience. So from that standpoint, the objective is to really focus on those clinical experiences.
Wow, the hair is really amazing. Look at this. This is great. Great stuff, guys. Thanks very much, James. James Arquetto, Dr. Mike, a pleasure. Thank you, HAL.
Thank you.
Really interesting.